So this morning's 10 Minutes to Your Health talks about the effects of trauma and injuries in children. Here to educate is consultant ear, nose and throat surgeon, or an otolaryngologist, and she works at the Bustamante Hospital for Children, Dr. Marsha James. Welcome to Smile. Good to see you. How are you?
Thank you. Good morning, Neville.
No,
I'm good.
I told her I said I was going to say, wagwan.
Yes, you did.
Yeah, we had a kind of discussion like this earlier. I'm sure you saw and probably heard everything that was said. But it is scary to think that our kids, so many of them are being hurt. I would like to think unintentionally. I would like to think accidentally. But is it more than that? Is it incompetence as parents? What's happening here?
Well, most of these injuries are actually accidental injuries, but it results from a lack of supervision. So we think that if parents execute more supervision of the children, then we can reduce the incidence of these injuries that we see at Bustamante.
Yeah, I told a story yesterday about my own son, that I just kind of looked like that and he fell off the bed. So I know accidents can happen, but when you hear of youngsters ingesting bleach and stuff that we put in soda bottles, what go on there, sir?
Right, so for the ENT service, we get a lot of what we call caustic ingestion. So unfortunately, a lot of persons don't buy the bleach and cleaning products from the supermarkets and other regulated retailers. So they'll buy it from the wholesale and they'll buy what they call retail bleach. But this is not pure diluted chlorine bleach. It's sometimes a mixture of caustic soda, bleach, and bleach powder. And this can be very damaging. And they tend to store them in regular drinking bottles, so water bottles, soda bottles, and for some reason they want to store them in the fridge or somewhere in the kitchen where the children have access.
Bleach in the fridge?
Yes, I'm not sure why. But these can be very damaging, especially to small children, so they can get burns to the lips, to the tongue, and to the food passage. And caustic soda is very, very damaging, and it can actually destroy the entire food passage, and the patient may have to have major surgery just to be able to eat.
Damaging for how long? Long term we're talking about?
Long term, they may have to actually remove that damaged gullet or esophagus, as we call it, and actually bring the stomach all the way up just for them to be able to feed.
Why? If I'm at home, God forbid I can't get to the hospital and something like this happens, is there anything I can do at home to kind of alleviate?
Right, so we recommend that you do not try to induce vomiting because actually what you're doing is causing the same substance to come back up again and cause further damage. So you can give them just some water or nothing at all and just rush straight to the hospital.
Then if it don't come back up again, it's not going to do damage if it's staying there?
Well, the esophagus is not as resilient as the stomach, so we'd prefer not to have a second pass, and we can give medication to help to neutralize some of these substances.
Yeah. What about the falls? I'm also told that a lot of the kids are head injuries because whether they fall off the bed or they just drop, or what about that? How damaging can that be from a long-term standpoint?
Yeah, so, depending on the nature of the fall and the height, so we talk about falls from heights. So the higher that the fall occurs, then the more damaging it can be. So even babies falling from the bed can be quite damaging if they fall on a hard surface. So patients can actually suffer memory loss, behavioral problems, developmental problems, learning problems, and in some cases they can have damage to their hearing. And we even had a patient who fell from the bed and lost her vision.
Whew.
Yes, because of the part of the brain for good, because of the part of the brain that was damaged. And then if the fall is very severe and there's bleeding, you can also end up in a coma, or unfortunately we have lost patients. Patients have died from falling from heights.
We're talking about kids?
Kids, yes. So at Bustamante we see up to 12 years.
Apart from being a doctor for my child, do you report me?
Yes, we do. So that's why we work with the social work department. So the social work department actually counsels the parents after they are admitted and we have treated them. But the aim now is to actually prevent. So we want to prevent these injuries from happening. So we want to increase the awareness. During the pandemic, we realized that the numbers really increased, and we think that's because a lot of children were home unsupervised or not properly supervised. And sometimes they're left with older siblings who also don't know how to supervise them properly, which is why we're trying to get the message out to a wider audience. So we partnered with the Ministry of Education and they're going to help us to disseminate this information.
I'm speaking with Ms. Spence, the social worker, 2019, caustic agents ingestion and falls was 876.
Yes.
In 2020, it was 1,164.
Yes.
In 2021, it was 1,300.
Exactly.
142 cases of head injuries in 2019, increased to 225 2020, 229 2021.
Right.
And so far this year, there have been 93 cases since the start of 22. You have people with burns, 121 cases in 2019, 145, 2020, 127, 2021, and 27 so far. Does this surprise you? That the numbers keep going up. I know you mentioned the pandemic, but
Yes.
does this surprise you?
Well, we're concerned because we have been trying to educate our parents, but the pandemic has certainly played a role. So we have seen our numbers trending up over the past 2 to 3 years. And even this year, we realized that we're still having an uptick, even with them trying to phase back, face-to-face school. So we think that it's important for us to really educate the public so we can reduce the incidence, especially with low resources at the hospital. If we can reduce the patients who actually have to come in, we can manage our resources better.
Before I said that if you report me,
Yes.
and I meant like to the police, like if I bring in my son
Yes.
and him have a bad cut at him head, and I just say, well, I'm drop off of the bed. Is there any investigation done to ensure that him really and truly it was just a little accident and he's not vex and fling him off of the bed?
Right. So we report all our patients to the social worker, and they will do an investigation, and sometimes they'll actually do a home visit or they'll do a deeper probe, and if there is any suspicion of non-accidental injury or negligence, then we report them to the CDA, and they take it
I'm
from
not
there.
certain if you know that, but does that happen a lot, that you have to report them to the CDA?
Yes.
It
Because there are
happens
parents as well who don't want to take responsibility, or there are parents who won't allow the child to get the appropriate medical intervention that they need. They want to sign the child out at times. So we do have to.
Why? Why do they want to do that?
Because they don't think it's serious, and they don't realize that some of these injuries have long-term complications.
Yeah. I don't know how long you've been doing this, but have you seen like a 3-year-old who got hurt and then come back at 11 and still have some issues? I don't know how long you've been doing this,
Well,
but have you seen anything like that?
Yes, we've seen that with a caustic ingestion. As I said, you can get damage, so they have stricture formation and difficulty swallowing. The neurosurgeons would have seen patients who come back with gait problems. They have seizures, chronic headaches, memory loss.
And this is all because of a fall when you were a year and a half?
This is all because of a fall when you were younger.
Wow. Are you getting the word out? Are we learning?
Yes. And so we want to launch a campaign. So we're actually having, for Child's Month, a competition. So at the primary school level, we're doing a poster competition about safety. And at the high school level, we're doing a jingle competition that will be posted on TikTok.
And this is for awareness?
This is to increase awareness. But our child safety awareness program is actually going to be year-long. So we'll have other activities outside of Child Month.
Boy. Look after all the kids, please. All of us need to look after the kids. And I know that there are accidents. I said it, that my son fell off the bed, and that was an accident. Luckily, he fell on his rump.
Yes.
And not his
head.
His head. So we pray that, well, he's a big man now, so hopefully he's all right. Good to see you.
Thank you for having me.
Our pleasure. Dr. Marsha James, consultant ear, nose, and throat surgeon, and otolaryngologist at the Bustamante Hospital for Children. I love the word. I learned it recently, but I was interviewing someone from our diaspora check-in, and when I said, who is that? And he said, ear, nose, and throat. What kind of word? Make never just said that from day one under the argument. But I learned a new word. God bless you.
Yes, thank
All
you.
Right. Her name is Dr. Marsha James, and again, she's a consultant at the Children's Hospital, Bustamante Hospital for Children. 10 minutes to your health. We'll do it again next Thursday.